We are back at Local News Live. I'm Deborah Alfaro. Now, obviously, you know the Super Bowl was Sunday, and following the Kansas City Chiefs winning, now the NFL season is over. But there's this study I want to tell you about. A new Boston University study found CTE in more than 9 out of 10 brains of former NFL players. So I want to now talk to Dr. Nina Radcliffe, and she knows about this. Nina, thank you so much, Dr. Nina, for being here. We've been hearing about CTE more and more. So tell us, what exactly is it?
Well, this is a great opportunity to discuss CT with the Super Bowl being yesterday. Over the past year, Rick Arrington, who was a former quarterback for the Eagles, and Ed Lothamer, was a former defensive tackle for the Chiefs, were both diagnosed with this conditions, and both teams were in the Super Bowl. And what we know is hits to the head that is a risk factor. And so CTE, for those, it's chronic traumatic encephalopathy. Then this is a degenerative brain disease that's caused by repeated head impacts, like the ones football players experience throughout a game, throughout a season and their career. And it's been found in athletes, military vets, and others with a history of repetitive brain trauma. Now, the brains with CTE show a buildup of a protein called tau. TAU, that's around the brain vessels. And interestingly, this is the same protein that abnormally accumulates as tangles in Alzheimer's dementia. Now, getting into the nitty-gritty, the symptoms of CTE, it can be impairments in mood, like depression, suicidal thoughts, irritability, behavioral changes. You're explosive, you're violent, impulsive, cognition, which is considered thinking, so impaired memory, executive function or dysfunction, and diminished concentration, and even problems with motor function, so Parkinson type symptoms, difficulties with walking, and weakness.
There are just so many things. The brain is just such a fragile object. So I want to ask you a little bit about CTE and concussions. What is the difference between the two?
Right. Well, concussions is any time there is an injury to the head where there's an impact and there's a bump, a blow, or a jolt to the head or a hit to the body that causes the head and brain to move rapidly back and forth. We have to remember there's a skull. And our brain is soft tissue. And anytime it hits it, there can be injury to it. And most concussion symptoms resolve within a few weeks. And this includes headaches, nausea, vomiting, balance problems or dizziness, double vision. You're bothered by light or noise. You feel sluggish, hazy, and confusion. Now, having a concussion doesn't mean you're going to develop CTE. What it does mean is that more concussions over time, especially over a career that's successful in football, it can lead to these symptoms of CTE.
Okay, so a concussion is not necessarily CTE, but these types of situations can lead to it. Research does show that suggests that being successful as a football player likely results in CTE at every level, including high school. So what's the impact of continued play? I mean, if you start in high school and then you continue on, what is that impact like?
Well, we want to make sure kids start playing tackle sports at a later age. We want to watch that. There should be some changes in the rules of the game. We definitely don't want to throw out the baby with the bathwater. And I do want to point out, even though this study showed that 9 out of 10 brains that were examined show CT, does not by any means mean that current or former NFL players, 9 out of 10 of them have that. There was a selection bias in who donated their brains to the CTE Center at Boston University. So there are things, one of the goals is to have a diagnosis during life. The diagnosis oftentimes comes after you're dead, when you've donated your brain and they can autopsy it, look at it under a microscope. But by diagnosing it during life, there's changes that can be made, especially to the mental changes, the emotional changes. There's controls that can be made. And where this is important, anybody who's incurred repeated impact to their head, they should seek help early if they start seeing that there's changes in their mood, there's changes in their behavior, they're having difficulty with thinking. And what happens many times with brain issues, whether it's stroke or Alzheimer's, it requires the people around them, their loved ones, to notice these changes and get them to where they need to be to seek help and health care.
That is a critically important fact, Dr. Nina. And again, you point out that maybe there's a bias. The brains that were donated, maybe those were more likely to have CTE. And again, you say you don't know until you're looking at a brain like after the person has passed, but what can be done to prevent it while you're playing?
Right. Well, we want to worry about protective gear, not worry, but we want to think about that. There was a terrible concussion injury where there was a lot of criticism about how they managed it in the NFL. And after that, there have been changes to the rules of the game when it comes to concussions. We also want to have protective awareness, monitoring, managing. And again, we want to make sure our kids start later when it comes to impact sports because their brains develop differently. And of course, if you've had a concussion, we have to have the utmost of precaution with that. We don't want to put somebody back in the game, no matter how much they want to do it, because oftentimes after a concussion, you're not thinking right, but you have all this energy and epinephrine and testosterone or whatever's pumping through you. You want to be part of the team, you want to be part of the game. But this is where the people on the sidelines, the coaches, whether it's the NFL, whether it's collegiate, whether it's in high school, whatever it is, has a responsibility. The people on the sidelines, the parents. And it's when we demand these changes that changes are made, and we will see progress.
This is good information for parents out there, coaches, people who love people who play football. You have to, of course, make sure that you're watching the signs. All of this good, helpful information. Dr. Nina Radcliffe, we really appreciate your time today.
Thank you so much.
You're so welcome. You're watching Local News Live. We'll be right back.